I will just talk about how do we read CT scan, or how do we read X-rays, or how do we take X-rays. Now, these fracture calcaneum we diagnose on X-rays. We do read soft tissues well. We have to read soft tissues which are not seen on X-rays like this, and then we have to read CT scan as well. How do we go about it? This particular injury looks innocent, but this has settled down in 3 weeks. It takes long time, and but till that time, even we have to read fracture geometry. So AP lateral X-rays are important, but even axial views give us enough information. How do we read them? AP X-ray shows us if there is a lateral wall blast, and lateral view shows us how the posterior facet is aligned, and also it will give us idea about length breadth. Axial view will give us an idea about the varus angulation and also about the posterior facet. In addition to that, if we can take Broaden's view, it is helpful. But obviously, CT scan is going to add to our knowledge. Look at this. Now, CT scan is important, but how do we read CT scan? Now, generally, if you ask to take CT scan, any technician will take the sections like this. Now, this is orientation for the ankle. Okay. Now, look at this. Vachesa, are you able to see my cursor?
Yes,
My
yes,
pointer?
yes, yes, yes.
See, now this section is going to cut the posterior facet at this angle or at this angle. But look at posterior facet, it is aligned like this. So unless you realign your sections parallel or perpendicular to the posterior facet, you are not going to get correct answer. So look at this now. So we have to go to the console and align it like this. Now look at the difference between these two. This is for ankle. So this is going to give me good information about the ankle articular facet. But you should
Sampat
go to
sir,
the, yeah,
just I want to interrupt.
yeah.
The orientation change can be done while doing the CT scan, or you can do it after the CT scan also.
You can do it afterwards, sir. So let the technician take it his own way.
Okay.
You go to the console, and
Okay.
there is a software. I will show you. See my
Okay.
cursor, sir. There is a software where such arrows are written. You just
Okay.
click and then you can change the alignment.
Okay. So it is not necessary while patient CT is being done, we should be present. We can go our own time by our own time.
Absolutely, absolutely.
Okay.
So
Thank you.
go according to your own time.
Yeah.
If possible, ask them to take with 0.6 mm cuts.
Okay.
But mainly 0.6 mm cuts are available in CT scan above 16. So 16, 64, 128 slice. But whatever smallest section he can take, he should take it. And then you go yourself and then study. Now,
Thank you.
see this. So our aim is to make it parallel to this. Got my point?
Yes.
This is our aim. Then you will get more information, because anything which is cutting like this is obviously going to show you very bizarre picture. You may get to see some pictures where posterior facet is too comminuted, but it is not going to yield correct information. So remember, this is the usual section taken, but we want like this.
Agree.
Okay. So see now, see where to study. You have, each and every section is important, but you have to study in a film where there is a widest facet of the posterior facet of talus. Got my point?
Yes.
Because in calcaneum there are three facets: articular facet, anterior, medial, and posterior facet. But if you consider for practical purpose, any intra-articular fracture of calcaneum is basically more in posterior facet only. We hardly consider anything about anterior facet or middle facet. So it is everything about posterior facet. Now, if I have to study the posterior facet of calcaneum, I have to see where is the widest facet of talus. And there you see, now see, it is absolutely down here. So this is lateral wall. If I have to elevate, I have to go inside the lateral wall and elevate it here. Got it?
Yes.
So this is how one should study the CT scan, and then it will yield you good information. So I will just repeat it. This is how make it parallel, not like this, and then study all sagittal, coronal, and then if it is aligned well, then you will see, okay, this person does not need surgery. But at widest part of posterior facet of talus, if it is like this, then definitely I will go there. And plus, it will yield more information. If time allows, then I will present one more classification where it will tells you where is the posterior facet. Is it up here, down here, or down here? So you have to consider, as Pradhan sir has told, or subsequent speaker will show in their cases, from where you have to elevate this posterior facet. Is it from the lateral wall inside, or somebody who is taking lateral extensile approach, where he will see the posterior facet? Somebody who is taking lateral extensile approach, he will remove this lateral wall, and then only he can elevate it. Okay, so this is how one should read the CT scan. Now, last portion, I always tell one sentence to my all colleagues: never start calcaneum case without checking an axial view, and never leave the OT without seeing a good Broaden's view. Okay, simple. That means if you start without seeing the axial view, that means sometimes what happens is our end of the table has metal end, and sometimes seeing axial view is really a challenge. Okay, so that's why you see preoperatively, see how the patient has to be moved. So see, before pending draping, start with axial view and end with good Broaden's view. I will end with only 2 slides. See, I generally operate in lateral position. Now, lateral position is little floppy lateral. That means the posterior buttock of the patient and posterior support has at least gap of 4 fingers, so that he can lean behind. Okay. Now, patient is lying in lateral position. Siam is from the front. I am standing from the back. Samaram, is the orientation all right?
Yes, yes, agreed.
Okay. So this way I can see very good lateral view.
Yeah.
Okay. Now what I am going to do, I am going to externally rotate the patient's leg, and simultaneously I am going to pull patients towards me, so that the foot is looking absolutely towards ceiling. See this. Okay. Foot is absolutely looking towards ceiling, and this Siam is going to make angle of 20, 30, and 40. Okay, to see the axial view. I am holding hand here, but generally I will give sterile bandage so that your hand irradiation is not there.
Yeah.
This is how we see the axial view. Okay, got my point? So
yes.
Foot is up here, and my this hand is the 40-degree angle of the tube. Sometimes if your CM technician is not senior enough, what I will suggest you, see, this is a practical point. This is my X-ray tube. Got it?
Yes.
Now this is my foot.
Okay.
But my CM technician is not able to give me 40-degree like this. So what I do, I elevate my foot.
Okay.
Simple?
Yes.
Got it?
Agreed.
See this. This is like that. But then 30-degree elevation, you do it, no?
Agreed.
Got my point? So this is how I'm lying. This is my leg. This is my foot. And this is my X-ray tube. Don't ask X-ray technician to do any extra job. Elevate it 30-degree like this. It does a job for you.
Right.
Okay. So without moving X-ray tube, you can take lateral view. You can take axial view. And how to take Broaden's view? Just internally rotated 30-degree.
Okay.
So without moving a tube single time, you can take lateral view, you can take axial view, you can take Broaden's view. See this. This is axial view. If I don't want to move this tube will remain straight, but I will lift it 20-degree up.
Yes.
Simple, sir?
Yes, yes.
I'm not making complicated, no?
No. Clear.
So this is axial view and this is Broaden's view. Simple. So Broaden's view will give you how the facet is elevated or how it is going to go ahead. And axial view is going to give you varus or valgus. So what Pradhan sir and what subsequent speakers are going to speak, I'm reiterating those points. In fracture calcaneum, you have to start with seeing good axial view and end with good Broaden's view. You do your way. You do lateral extensile approach, you do sinus tarsi approach, you do your way. But at least these 2-3 things you should see. by saying this,